Welcome to the training video on enhancing family presence during resuscitation in Canonsburg Emergency Department, a clinical decision pathway. The purpose of my project is to implement a clinical decision pathway using an evidence-based algorithm to guide emergency department staff in the safe and effective integration of family presence during resuscitation events. The objectives of this training are to understand the significance and benefits of family presence during resuscitation, identify the challenges of family presence in a rural ED setting, examine the evidence-based literature findings that support it, and to implement and utilize the algorithm to support family inclusion. Throughout this project, we will talk about family presence. But family is a group of individuals who are either related by blood, marriage, adoption, or chosen bonds. Is family presence important? There are psychological benefits for patients that may lead to improved outcomes when families are supportive and able to give pertinent patient information, and provides emotional support, which can reduce stress for patients in some cases. The psychological benefits for families are that it helps families feel more involved and less powerless. It reduces feelings of anxiety and uncertainty and can offer closure in the cases of patient death. The major goals of implementation of family presence during resuscitation is to enhance family-centered emergency department care, implement structured, algorithm-driven family presence, and to ensure safe, compassionate decision-making. Expected benefits include improved patient and family satisfaction, better patient outcomes, and reduced moral distress on the ED staff. Restricting family presence during resuscitation can heighten staff moral distress because it conflicts with their duty to provide compassionate, patient-centered care. Organizational change opportunities may include a cultural shift towards more patient and family-centered care in the emergency department, along with policy changes, which includes the implementation and integration of family presence during resuscitation into hospital policy with formalized guidelines. Overcoming concerns. First, many of our staff have limited or negative experiences with family presence during resuscitation, which can create hesitation. There are also concerns about disrupting resuscitation efforts and the legal implications of allowing family members in the room. Some worry this could expose the hospital to litigation, but literature shows that family presence during resuscitation does not lead to higher litigation rates. Another concern is the impact on patient care. While the effects on patient outcomes are still under research, studies suggest that family presence improves family satisfaction and emotional support. Additionally, there is worry about increased emotional distress for families, but long-term data show that family presence can reduce post-traumatic stress disorder and anxiety in family members long-term. Finally, there is a concern about staff experience. However, research indicates that family presence can improve job satisfaction among staff and lead to better patient outcomes overall. In conclusion, while these challenges are real, addressing them thoughtfully can lead to significant benefits for both families and staff. An ethical dilemma may arise in balancing patient autonomy and family preferences with clinical judgment. It is essential to ensure that the inclusion of family members during resuscitation does not compromise patient safety or privacy. The next two slides depict the algorithm that I chose to use for this project. It's based out of an article called Developing a Decision Pathway for Family Presence During Resuscitation by Tennyson and colleagues. The algorithm is difficult to see in this PowerPoint presentation. Therefore, there will be lanyards with cards and also pictures of the algorithm itself distributed throughout the ER. And now I will take you through the algorithm itself. The code blue event is initiated. A family facilitator is assigned. This can be a nurse, a social worker, a chaplain, or a specially trained volunteer. Next is family present. If so, family facilitator introduces themselves to the family. They engage with the family and provide crisis response care. They assess the family's medical knowledge and comfort level. If the family is not present, they determine if the family has been notified. They stay with the clinical team for updates, and they can be available to family virtually, and they consider staying until the end of the code. Next is determining the appropriateness of family presence. Is the situation appropriate for the family to observe? Exclusions may include unsafe physical conditions, space or sterility needs, a patient with open chest or emergency thoracotomy, or airborne isolation, to name a few. Exclusions may include the family's inability or unwillingness to follow the ground rules, if they are extremely agitated or violent, or if they may obstruct the resuscitation efforts, or if they are believed to be under the influence of drugs or alcohol. Ongoing assessment and continuous evaluation is necessary. Staff must monitor the situation and family eligibility as things may change. The family facilitator may prepare the family to explain what they will see and hear. They will set expectations, describing the potential noises, smells, and sights. They will also escort the family into the resuscitation area or out of as necessary. They will provide support and ensure that the family feels supported and safe in the situation. Next on the algorithm, does the family wish to observe? If yes, proceed with the next steps. If no, the family facilitator may remain with the family and provide support outside of the resuscitation area. The next important step, does the code team agree to family presence? If yes, the family facilitator describes the ground rules, and if agreeable, family is accompanied into the resuscitation area. If the answer is no, the family facilitator ensures family understands the information provided from the medical team. During resuscitation, the family facilitator stays with the family to provide support and answer questions. They monitor the family's coping and willingness to remain in the room. At the conclusion of the resuscitation efforts, immediate support is provided for the family. After resuscitation, if the patient survived, we are going to assist the family to a higher level of care for their family member. If the patient was pronounced dead, we provide bereavement support and honor the patient and the team. Next on the algorithm is the debriefing session with family and the healthcare team. The family will be offered follow-up support and resources, and the family facilitator will participate in the code debrief as able. Thank you for listening to this presentation, and I hope that you will use the algorithm to allow family members to be present during critical times for their loved ones. Thanks again.